Good morning, everyone, and welcome to the second of LSBU's AHP Practice Learning Showcase. And today we are focusing on diagnostic radiography. My name is Neil Hudson-Basing. I'm the Corporate Events Manager at London South Bank University, and I'm just going to take you through a bit of housekeeping before we start. First off, I'd just like to read you a short statement around respect and dignity. Everyone speaking at or attending an LSBU event, whether in person or virtually, should be treated with respect, dignity, and courtesy. LSBU operates an environment built on equality, inclusion, and acceptance. We value contributions, feedback, and comments, and wish to create a space for sharing, learning, celebrating, and bringing communities together. LSBU does not tolerate any form of bullying, abuse, harassment, or discrimination. Inappropriate behaviour, including that potentially impacts or contradicts LSBU's reputation or values, will be treated seriously and acted upon. Anyone exhibiting any example of this behaviour will also be removed from the webinar. We want our events to be an enjoyable, safe, and warm experience for all. Thank you for adhering to these guidelines. So just to take you through the Zoom functionality, you will see two options at the bottom of the screen. There's the chat box, and it's brilliant to see people making use of that already. Please do continue to use that to let us know who you are, what you do, and where you're joining us from. In the absence of being able to meet physically, it's great to kind of know who our audience are and help us break down that virtual wall that we're all experiencing at the moment. The next button along is the Q&A box, and I'd like to ask you to reserve that for your questions for our panel today. You'll see in the Q&A box that there's a thumbs up symbol next to questions. You can upvote on the questions you most want to see answered by clicking on that, and we'll get round to them shortly. That's all from me. Without further ado, I'd like to hand over to my colleague Gail, who's going to kick off the event. Gail, over to you.
Good morning, thank you. Okay, let me just share my screen there. Okay, so I'd like to just introduce myself. I'm Gail Edwards, and I'm the Head of Division for Radiography and ODP at London South Bank University. And I'd like to just welcome you to the AHP Practice Learning Showcase for Diagnostic Radiography. So this is one of a series of events for allied and community health at London South Bank University. So today we're looking at diagnostic radiography. Okay, so I'd just like to welcome you all to join us. Thank you all for attending. It's great to see that so many of you have joined us today. We look forward to sharing with you our work and talk to you a little bit about what it is that we're doing and what we have planned over the next few years. I'd just like to introduce the team that we have today. So we have Harry Bliss, he is our Diagnostic Radiography Course Director. Yvonne Thackeray, who is one of our senior lecturers, and she is our apprenticeship lead for diagnostic radiography. We also are lucky enough to have Violetta Versner with us. She is one of our level 6 diagnostic radiography students, and she's going to tell us a little bit about her experiences while she's been with us on the course. Claire Carter is our diagnostic radiography practice placement lead. So she will tell you a little bit about things like simulation. We have Thomas Ince, he is our AHP practice learning lead, and we'll be joined by Chloe Keithshop, who is the AHP clinical fellow and from Health Education England. So it has been a challenging year. I'm sure that won't have passed any of us by. It's been very different, something that none of us have ever experienced before with a global pandemic, which has changed the way that we work and the way that we deliver our courses. The team has moved quickly and changed how they work into an online delivery of teaching. And although we've had some forms of remote learning for quite some time, we've had to quickly move to exclusively online learning and simulation to teach our students during this time. The students have risen to the challenge really well. They've engaged with the new forms of learning, and our level 6 students successfully completed their courses and their placements to enter the HCPC temporary register and join the workforce on the front line to support the NHS during the pandemic. Some of our first and second year students had their placements suspended, but all students have now managed to catch up with that missed clinical time and are progressing well and as expected with their courses. So we would like to give our thanks to all of our clinical partners for all their efforts throughout this time, The support that we've received from you has been incredible. Support to the staff, support to students, all whilst supporting the whole of the NHS and looking after patients through one of the most difficult times in any of our careers. So a big thank you to all of our clinical partners. In the future, we've learned a lot from what's happened in the past year. So we're looking forwards to how we can take some of the best parts of this forwards with us and how we can build this into our future deliveries. So thank you for joining us today, and I will pass you over to Harry Bliss, who's the Diagnostic Radiography Course Director.
Thank you, Gail. Just sharing my screen now. Thank you so much, everyone, for coming. As Gail said, my name is Harry Bliss. I am the course director for Diagnostic Radiography. So a little bit about myself. I actually qualified from LSBU in 2009, where I went to St George's Hospital in Tooting, Southwest London, where I worked until 2017. Leaving as the Deputy Superintendent of General X-ray, coming to LSBU, where I started as placement lead and now course director. What I've been asked today is just kind of give a little bit of an overview of where placement sits in our year plan and how that evolves. For our clinical partners, you've been aware that this year, so 2019-2020, was actually a bit of an unusual year plan for us. We had to make some modifications based on the Council of Dean decision to stop first years from attending placement, which then was obviously reviewed. But obviously going forward, we're going to really return to our traditional placement format. So I know for those who aren't radiographers in the audience, we actually run a slightly different placements compared to some like AHPs. And really our placements are very much integrated into the entire year plan. So rather than large blocks of placement, we very much have kind of smaller chunks, which we have diffused throughout, which allows our students to learn the academic, the theoretical part of the course, and then really take that to placement and engage. As you can see here, so obviously interacting with things such as revision weeks and assessment weeks as well. How we assign our placements at LSBU is that in level 4, we allocate our first clinical site. That could be either for a student, a large major trauma centre or larger centre, or a district general. And then at level 5 in the second year, they then would switch to an alternative. So if they did a major trauma centre in the first year, they'll be going to a district general in the second. And in the third year, which is level 6, you can see what we would do is we have kind of a 50-50 split. So that allows the students in their final year to engage with the major trauma and some of the more complex, and then going to the district general where they're going to see a lot of work, which might be what their first post may be. And as you can see for our level 6 students at the very end, we finish with an elective placement, and students can engage with some decide to work in the sites where they got their first post. Some wish to choose and explore more of a specialist kind of centre for that. So realistically, we are driving for expansion at LSBU, and that's really headed by the People's Plan and the long-term plan, because we know that we need more AHPs in the workforce. We knew this from what happened during the pandemic, and at LSBU we're really behind that, and we really want to take aboard what the HEPC and HE and NHS England have said, and really drive and increase our numbers of students. And obviously to do that, we need an expansion strategy. We need more placement sites so we can accommodate more students. I know Tom is going to be discussing this a little bit later on, the kind of the LSBU's overall HP policy. Thank you so much for your time, and I look forward to answering any questions you may have later on. Thank you.
Hi everyone, I think it's me next. So I'm just going to share screens. Perfect. Okay, so in line with the long-term plan, we need to increase our AHP workforce by 27,000 and another 4,000 from the Richard's Review of Diagnostic Services, which means supporting more students so they can join our future workforce and teams To support this work, last summer, Health Education England gave £1.2 million worth of funding across London, and my role is to support practice learning for AHPs across the capital. I'm Chloe, I'm a physio by background and AHP clinical fellow working with Laura Ledsford, our London AHP lead for Health Education England to support practice learning. It's fantastic to be here and be part of the work LSBU are doing to support diagnostic radiography practice learning. Capital AHP is the joint work by NHS England and NHS Improvement and Health Education England. Here you can see the work that's been developed across the capital to give an overview. As part of student practice learning, we're really working in the first aim around learning and development. There are lots of relevant policy documents, but as Harry mentioned, key to this conversation are the long-term plan, the people plan and AHPs into action. Health Education England are working across lots of programmes of work. The main work to support students is the NETS survey, AHP faculty testbeds and repair, which you can find out much more about on our website. During the first wave, we showed that AHPs are agile, adapting quickly to the changing circumstances and managing to have over 700 students out on placement with a big push in innovation and use of digital. And just wanted to highlight that there are lots of challenges and barriers to practice learning, some staff related such as redeployment, sickness, annual leave and burnout, environmental factors such as social distancing, small offices, small spaces. And it's important to think about each of these barriers so we can work out how we might be able to overcome them to continue to support our students. Many of you will have seen and engaged in the crowdsourcing event, which has formed some of the evidence for the objectives of the Health Education England Practice Learning Expansion Programme and commented on these 6 main themes, particularly types and models of practice learning and the potential diversity of practice learning settings, how we can coordinate practice learning to best effect, standardisation, particularly of paperwork, and terminology. So the reason I'm trying my best to use the term practice learning rather than placement throughout this presentation. The programme aims to ensure adequate AHP practice learning capacity and quality and has measurable objectives and outputs, including increasing practice learning and evaluation of the funding. But also there's a practice learning exchange set up to share resources and ideas, which you can join through our website shown here. And you can find links to resources such as webinars, quick guides, which have been developed on the Health Education England website. In London, as we said, £1.2 million of funding was given from Health Education England to support practice learning. And largely this was spent on roles such as practice education facilitators to support the work highlighted in the programme, particularly around coordinating placements and considering new placement models and settings, as well as providing laptops, tablets, and thinking about text placements. In London, we've set up some opportunities to engage with practice learning. We have some breakfast placement sessions which are going on this week. We've got the AHP Practice Learning Club, which is an MS Teams group and community of practice. And really this is a space to connect and network with lots of resources available. And we have our weekly AHP Practice Learning Masterclasses, an opportunity to hear from experts in the field about their experiences. Please do get in touch with us if you'd like to be involved. Our email address is at the bottom. Thanks so much for listening. I'm very happy to answer any questions and we'll share the slides as there are some links and resources at the end. Please do give us a follow on Twitter to keep up to date with work going on in the capital. I hope to have highlighted that we need to grow our AHP workforce gradually over the next few years, and currently there are real challenges to student practice learning, but hopefully we can tackle this through considering every opportunity, which the team here at LSBU are progressing with to develop sustainable practice learning for our AHP students and future workforce. I'm going to stop sharing and hand over to Thomas, who will talk through this all in a bit more detail. Thanks.
Thank you, Chloe. I'm going to share my screen now. Lovely. So as Chloe's mentioned, and kindly given us an insight into the HEE's wider view on the direction of travel for AHPs across London. So for those of you that don't know me, my name is Thomason, and I'm the AHP Practice Learning Lead here at the university. I work closely alongside our nursing and social work practice learning leads to ensure we are providing a diverse and adequate number of practice learning opportunities for our students here at LSBU. I'm going to present to you how we intend to take all the information that's out there on the internet, the platforms, Twitter, so that we can collaborate with others and produce high quality practice learning opportunities for all our AHP students at LSBU. I've nabbed this quote from the HE website, which came from Stuart Norton, and sums it up nicely for me, the importance of practice learning as part of an AHP course. So as well as the students learning the clinical skills of their profession, it should also be about learning other things, such as the organizational community, the culture, professionalism, and lots more. That's so they can go on to become well-rounded professionals with the skills employers are seeking. Innovative approaches to practice learning will help ensure that it is not a barrier to increasing our student population and training well-rounded graduates. So in my role at the university, I've got three main missions. The first role is to expand the number of practice learning opportunities we have at the university. That's firstly to reduce the risk of placement shortfalls, and secondly to expand some of our AHP programs to meet the needs of the people plan, of which diagnostic radiography is one of those. We would like to ensure that these opportunities are of high quality and measured through a multifactorial approach, which we'll be looking at in a little bit. And finally, we would like to disrupt the status quo of institutionalized racism and colonialism with respect to practice learning. And I'm looking forward to presenting on this separately today. So with AHP practice learning expansion, we would like that all of our practice learning opportunities incorporate one of the pillars of practice within that placement as the primary focus. So for example, clinical is our most common pillar of practice. And as part of diagnostic radiography, there is a competency-based practice learning approach. This is to ensure that our future clinicians are providing safe and effective person-centered care, as well as testing out their professional judgment and decision-making. In addition to this clinical practice pillar, we want to explore other practice pillars in diagnostic radiography as part of elective placement opportunities. This may include the facilitation of learning through teaching and assessments and project work. It may also include leadership, so that includes work around teamwork and development, as well as understanding professional and organizational approaches to leadership. And finally, we would like our diagnostic radiography students to be more involved in evidence and research at an earlier stage in their development. Research and leadership are required at all levels in the organization. And if our students begin to understand how research is formed early on, then we can create better academics and research-minded clinicians moving forward. We also want to take the opportunity to look at our diverse and virtual placement opportunities, of which these have increased following the pandemic. So alongside the pillars of practice, we want to ensure that we look at these other opportunities. So firstly, for example, we've got ODPs who during the pandemic worked on ICU and A&E settings, and we're exploring how ODPs can be trained within these settings as well, not just within the theatre setting. We currently have some physiotherapy students on a role emerging placement within osteopathy clinics and being supervised by osteopaths. We want to take more advantage of virtual opportunities through peer-enhanced e-practice learning. And we are pleased to say that the university has been awarded about £240,000 to explore simulated and virtual opportunities for nursing, ODP, radiography, physio, and OT. And finally, we want to explore other role emerging placements that have come about from the pandemic. So for example, we've had a number of our AHP students on placement out in vaccination centres. This way they are supporting the local community and helping to immunise the population. What I'm basically trying to say is there are endless and limited practice learning opportunities out there in London and beyond for our AHPs. I think of it a little bit like a fruity machine. So it's got lots of lights, whistles and buttons to press. So to make this more achievable, we need to hone this down a bit like this padlock into some achievable templated opportunities to make it more succinct. So for example, we may receive an offer from a governing body, such as the Society and College of Radiography. That primary pillar might be a leadership placement opportunity, and the supervision model may be 2 students to 1 educator, and the modality would be virtual. Alternatively, we may have a setting where we have an AHP who've been offered within an outpatient setting. That would be a clinical practice learning pillar as its primary model. The supervision model might be hub and spoke, but that modality might be face-to-face. If we begin to start templating these models of working, then we won't have to continually go back to the drawing board each time we do it. LSBU has been and keen to collaborate further with our HEI colleagues and our practice learning providers to ensure we get the best possible outcome for our students. We have been doing this through a variety of forums, such as the Placement Club and Masterclass, which Chloe mentioned, HEI forums, LSAT, which is the London South East Placement Partnership, and various professional forum groups. In addition to this, we want to collaborate with the wider networks out there in London and beyond, such as our local community, Health Education England, the HCPC, our AHP faculties, of which there are 5 in London, and we have an LSBU representative at all of these. And then finally, for some AHP courses, the PMP Placement Management Partnership. Expanding practice learning must not come at the expense of quality. And our strategy is firstly to ensure that we are offering a range of patient and non-patient facing opportunities which reflect the pillars of practice. And these opportunities will be measured and monitored using our student profiles. Each practice learning site has a practice learning agreement, and in diagnostic radiography it incorporates a tripartite agreement to ensure that we're supporting educators, working with HEIs, and that LSBU and the placement sites understand the obligations under their agreement. We're going to review our quality monitoring audits and how we meet the obligations of the HCPC and ensure we have a consistent AHP student feedback form so that we're able to make material changes. And finally, we have support for training and educators. Apologies, this says it's for occupational therapy, just to get rid of the top line. So the learning outcomes for diagnostic education providers is the same, and we will work to ensure that you understand the roles of the practice educator, that we can facilitate the practice learning experience, that you have a good understanding of the paperwork, and soon we would like to incorporate anti-racist training and allyship training as part of our educator days. I'm now going to pass you over to Yvonne, who has looked at some specific examples with Violetta.
Morning everyone, I'm going to share my screen. You see that, everyone?
Not yet.
There now?
It's there.
Great, thank you. Okay, so moving on to clinical practice placements, what have we done? So within LSBU, students experience a variety of placements in the NHS acute trust and also community placements and independent sector. Our main clinical sites of placements are 5 main London sites: are Guy's and St Thomas's, King's College Hospital, St George's Hospital Tooting, Queen's Hospital Romford and Barts Health, and our smaller providers, district general hospitals, NHS and independent providers are Queen Elizabeth Hospital Woolwich, Down Valley Hospital Dartford, Princess Royal University Hospital Farnborough, University Hospital Lewisham, Royal Sussex University Hospital Brighton, East Surrey Hospital Redhill, Hammersmith and Charing Cross Hospitals, Epsom General Hospital and the Lister Hospital Chelsea Bridge. We also have specialist placement sites where third-year students study cardiac, neuro and breast, and these are Guy's and St Thomas's, King's College, the National Hospital for Neurology and Neurosurgery, and Queen Square and St George's Hospital Tooting. We are currently looking at expansion of placements within our NHS providers, and we're very excited to announce that we've had an expansion bid with Barts Health. We have an extra 10 places there. Also in discussion with another private provider who's looking at providing us with a further student placements there. The student placements, students are placed over 3 years, and the first year the students have 2 placements in the first year, 4-week and 11-week blocks, and they take place in general X-ray, emergency X-ray and fluoroscopy. In the second year, there's placements in 6, 7 and 9-week blocks, and they will include CT, MRI, ultrasound and nuclear medicine. In the third year, students undertake a 7 and 9-week block, and they also remained at one of the sites they originally studied at, and they also specialise now in cardiac, neuro and breast. Within South Bank, we are very excited because we have a simulation suite. So students can actually simulate working in the clinical department in a digital diagnostic room. LSBU launched a innovative Fujifilm D-Evo suite, and this is a digital diagnostic X-ray room. It has X-ray equipment, it has a table and a vertical bucky stand, and students participate in practical tutorials where they actually learn technique and practice on each other. They also use this for moving and handling technique as well. We also have a digital interpretation laboratory. So this where we can have a digital image interpretation lab where students can learn picture archiving and communication systems. And they also learn how to image evaluation. We recently also, very excitingly, purchased a new piece of equipment. It's a new digital platform for students to learn positioning. And they can do this at their own home on their own digital device. It's a virtual radiography suite of medical imaging modularities. It's called MedSpace VR. My colleague Claire is now going to discuss this with you and explain it.
Okay, thank you, Yvonne. Hi everybody, my name is Claire Carter and I'm the practice placement lead for Diagnostic Radiography. So as Yvonne said, we acquired this application last year and introduced it to students in September 2020. It's a virtual reality simulation package, and it was something that we've been considering to introduce to the course for a while. And we had learned that this has been successfully utilised in departments across other countries all over the world, where practice learning was sometimes difficult to provide due to remote locations and also lack of availability, usually for reasons other than a global pandemic. However, due to COVID, it turned out to be a very timely introduction for both diagnostic radiography students and lecturers at LSBU. And the application has been made available to all students across all levels of the cohort. And via a supplied link, students can download the application onto a device of their choice. And they're able to use the application to practice radiographic technique and imaging whenever they like. So it's an app, it's a little bit like PlayStation meets the X-ray room. There is a patient in the form of an avatar, which can be fully manipulated into a variety of positions within the room, and it can interact with all the equipment. For example, sitting at the end of the table, standing at the erect bucky for a chest X-ray, for instance, lying on the table for an abdomen or a knee X-ray. And students have the ability to move around the room just as a radiographer would, or they can choose specific camera angles in relation to the patient or the equipment. And all the equipment can be moved. It all has the same functionality as you'd expect in a real X-ray room, including the sound effects. Students can choose a variety of different body parts to image and can choose the appropriate exposure factors. Then they can actually expose and get an image. They can then view and compare their images against standard to see where they need to adjust or improve. It also has a great function where with one click, the body of the patient can be removed just to reveal the bony anatomy itself, which really helps with learning about the relationships of bony anatomy in positioning. The app's been also used by lecturers for live online workshops with students to demonstrate radiographic technique, and also the demonstrations have been pre-recorded and the videos made available on the students' virtual learning environment, where they can be viewed and as and when students need them and as often as they need them. So you can see it offers a lot of benefits for the course. Ultimately, it provides a safe space for students to practice and learn outside of the clinical. And although it's not a substitute for that, we've found it to be really useful. It's a very useful teaching and learning tool in the absence and alongside of the practice learning environment. Okay, thank you very much.
Thank you. We'll go back to my original slide. So moving on from, thank you, Claire. So moving on from that, LSBU actually provides a successful online delivery of practice learning educator training. Now, within the clinical settings, one of the requirements for society and college validation, of radiography validation, is that you have the correct number of practice educators within the clinical environment. This is also required within, we have tripartite agreements between different trusts with the university, so that we have the adequate number of students and practice educators within the clinical environment. So we actually provide here the practice educator training. So trusts can send selected staff for practice educator training, so they fulfill that requirement. We recently had one of these practice education study days in February this year. So moving on to the opportunities. Now, going back to the 4 pillars of practice that Thomas mentioned, 2 of the pillars relate to research and leadership. So within our 3rd year module, the students participate in a poster presentation, which is one of their modules, and that's related to the 3rd year clinical setting in breast, cardiac or neurology. They devise a poster and they present this poster to the staff, and we encourage them to further publish these posters and submit them for publication and presentation at conferences. We also have a literature review module in the 3rd year, where students learn how to critically evaluate literature, which they can incorporate in this poster. So that's how we encourage research. Currently, I'm in discussion with the Society College of Radiographers to develop a leadership module. This is another part of one of the 4 pillars, and this is looking at a way of how to incorporate leadership placement within LSBU, so students can learn how a project works and also how the professional body works. So thank you for that opportunity to speak, and I'd like now, I'm very excited to say we have a 3rd year radiography student, Violetta, and she's going to talk to you now about her experience on clinical placement. Thank you.
Thank you, Yvonne. Hello everyone, good morning. Thank you for having me. So my name is Violetta and I'm a final year diagnostic radiography student. So I would like to tell you a little bit about my experience, how it's been over the last 3 years. And really starting from day 1, when I went to my clinical placement, I wasn't just there observing, I was really hands-on with the patients, pushed by radiographers to really do my bit. So I've noticed that now as I'm looking back, I've actually gained a lot of skills really early at the beginning of my degree. And towards the end of my 1st year, I was feeling really confident and really competent to actually do all of the exams myself, obviously under supervision. But I was really, really confident. And apart from plain X-ray, so general radiography, obviously we learn about computed tomography, about CT, about nuclear medicine, and about ultrasounds. And I'm gonna just focus a little bit on that ultrasound section actually. During my pediatric rotation, I had the opportunity to shadow one of the pediatric sonographers at the Children's Hospital. And because I was really interested and I was really fresh after my lectures, having the ultrasound lecture done, he actually gave me opportunity to perform the scan myself. And this is really unique opportunity because a lot of radiography students, they are mainly observing in ultrasound. So I was really, really happy that he actually gave me this opportunity. So that was my sort of a highlight of my 2nd year really. And in terms of my 3rd year highlight, so I've been to mammography, so I've been to breast clinic. That's one of the specialist placements, and I've been to cardiac cath lab, which is really interesting, really intense for students, really, but really interesting. And I've been to neuro placement, and this is the one that I really would like to focus on As part of my poster presentation, I did my poster regarding about neuroimaging of Parkinson's disease. So when I went to my neuro placement, I could really relate to a lot of the things that I've learned earlier. So I had a really good background knowledge when I went to the neuro placement, and radiographers there were really helpful. And all I had to do is just ask questions, and they were really giving me these opportunities. So one of the professors there actually took me to the MRI, interventional MRI suite. So it was really nice to the fact that he showed me, he took me to the operating theater and he showed me exactly what's happening, and he was really helpful and explaining everything to me. So moving on to the effects of pandemic, because obviously a lot of people are probably interested what happened to the students during pandemic. And although my placement was cancelled back in March 2020, I was given this extra time to really finish my level 5 portfolio. So I felt really confident with the fact that I still have a lot of time to focus on my level 6. And I've been to ICU wards, and it's been challenging. I have to say, after one of the days when I've been to ICU COVID wards, I've actually rang my mom and dad saying, it's been a really, really difficult time. So please do look after yourself. I think it's just because a lot of the patients were very young. They were at the age of 40, 50. So I could really relate to them as, the age of my parents. But when I went to ICU wards, I was really thankful and really amazed that radiographers gave me opportunity to actually lead the whole imaging procedure. So I had a lot of help, obviously, from the nurses, the ICU nurses there. But I was actually the person that would sort of coordinate the whole imaging procedure. So I've learned a lot of leadership skills, and I've observed great team working between, obviously, radiographers, myself, and the ICU staff. And I think pandemic really made me much more resilient, because obviously very quickly I had to adapt to all the changes, and there were a variety of changes that I had to keep up with. So yeah, if you do have any questions, Andy, and I'm more than happy to answer these questions. I'm happy to share with you as well that I've only got about 2.5 weeks of placement left and 2 exams. Hopefully it's going to go well. And I've managed to secure a job. So I'm going to start working mid-July. Yeah. So if you do have any questions, please ask. And thank you for listening.
Thank you, Violetta. I'm going to share my screen now for the next presentation. I apologize if I've got some background noise. Just started up just in the last few moments. Okay, I'm really proud and pleased to present this to you all today. So I'm going to present the AHP Plus Anti-Racism Practice Learning Strategy, which has really been a journey of collaboration and co-production. Before I start, I just really want to establish that, so this was the work that I'm presenting has been created by a number of different people. So firstly, Sherelle Tayson, who's an AHP student, myself, Almu Fernandez Alonso, who's also an AHP student, Mushrat Ahmed Landayu, who is an occupational therapy senior lecturer, and also 2 days a week is an anti-racist education practitioner. And finally, Dr. Anita Atwell, who's an associate professor in allied health. My fellow co-creators weren't able to make this particular session, so I'm going to be presenting it on my own, but please note that this strategy is not being spearheaded by myself as a racialized white man. So just to bring you to this quote, which was sent out by the senior management team at LSBU back in June of 2020, which really looked to ensure that our Black and minoritized ethnic students, staff, and alumni were equalized in terms of their experience at LSBU with relation to the curriculum and practice learning, and that we're committed to ensuring that we equalize the opportunities available at LSBU. So we know we've got the senior management buy-in for this work. I'm going to give you a brief background to how we've got to this point. So back in 2015, Chimani Maxwell, who is a South African political activist, started the Rhodes Must Fall movement, which related to a statue of Cecil Rhodes based at the University of Cape Town site. He started to use the word decolonize as part of the curriculum, so that we could begin to start thinking about how we decolonize the curriculum in South Africa. That then became a movement and then spread through South Africa and through the rest of the world. Following the introduction of Black Lives Matter and the murder of George Floyd, there was the start of a socio-political movement of discourse regarding the structures of institutions and ensuring that we don't continue with the status quo of the health and race inequalities that are out there, so that we would start to begin to disrupt that status quo. Our AHP bodies and organisations, including Suzanne Rustrick, came out in solidarity with the Black Lives Movement and hoped and claimed there would be change. AHP students who racialised as BME started to challenge these bodies after they didn't see change happening and things were plateauing. So there was reaction from our AHP bodies, from the student challenge, and the term decolonisation began to arise again in our AHP discussions. At LSBU, we have started 2 affinity groups, the Race and Culture Equity Group and the Allyship and Culture Group. So these are 2 affinity groups. The Race and Culture Equality Group is a closed group for our Black and minoritized ethnic students and staff. And our Allyship group is also closed, but you can request to join the meetings. Following the build-up of safe conversations within that environment, 2 of our AHP students felt comfortable enough to share their experience with myself and Rachel Picton, who's the Dean of the school. These stories were powerful and really ignited an ambition for change with regards to practice learning at LSBU. So we formed a very informal subgroup with myself, Nish, Anita, and several of our AHP students. We have two main missions. The first was to co-produce an anti-racism, anti-oppression, anti-discrimination, access-focused approach to practice learning. And secondly, we really wanted to disrupt the status quo of institutionalized racism, and colonialism with respect to our practice learning. A little bit of a reflection here from me. So when I started in the position and I've heard this information, I knew that I wanted to get some feedback, input, acknowledgement from our students from a variety of communities. I probably naively set up some events to see if we could get contributions from our clinical educators, our AHP students, and some of our other provider organisations, so that we could begin to develop this strategy together. They didn't go down. Wasn't great. It wasn't great. I had some good uptake from clinical educators and HEIs, but I didn't have up until the day of the talks, the day of the showcases. I didn't have any students on board. So I cancelled the events, and further discussions with Mish and Anita, and also some other EDI leads within other organisations, that I hadn't created a safe enough environment for these students to have these conversations. And when I began to come out and acknowledge that, I had discussions with a number of students who came forward who wanted to be part of an AHP practice learning subgroup. So it did have a positive effect through action, but not the effect that I initially thought it was going to have. So following this, we've created the AHP Antiracism Practice Learning subgroup. Alongside our 2 affinity groups, we'll work together in a flattened structure to achieve our outcomes and actions from our AHP anti-racism strategy. And that, working together with our AHP practice learning meeting, we're going to start affecting change. The affinity groups are there to enable safe space discussions, support exchange of learning and advice, and improve confidence in those people that would like it. This is going to be our model of action and engagement. And I've received a little bit more feedback about how this visualizes, and I agree that I think it needs to be more intertwined. So our change action, our actions are going to work alongside and intertwine with our student empowerment and engagement work. We want to initially start to bring students on board through engagement and empowerment, but as actions begin to build and students begin to see the work that we're doing in collaboration and co-production, we'll hope to get more students on board and involved and as part of this conversation. So routes of action, so you're all wondering what we're actually going to do. So our actions will be surrounded by a community of learning, a review of our current practices and policies, especially around complaint management and complaint pathways, especially around racism. And finally, we wish to have collaborative conversations moving forwards. So our primary aims are to be a critical friend when reviewing these policies and practice regarding practice education. Secondly, we want to provide members with the opportunity to learn and gain greater understanding from each other and grow as representatives of LSBU in the wider system. And finally, we want to develop a shared AHP ethos and network among practice learning needs with respect to anti-racism and allyship. So our primary actions. Firstly, we want to come up with a campaign umbrella term which all members are happy with. Secondly, we want to agree and collaborate on the terminology used in accordance with current best practice and guidelines. The term BAME can be offensive to some of our Black and minoritized ethnic communities. Number three, we want to support and provide advice through our anti-racism and allyship training for our linked tutors and our personal tutors. We started to engage a company to help support us in this, and we're keen to progress this quickly. We also want to provide anti-racism and allyship training as part of our educator study days, so that we're starting to involve our educators in this process. We understand that HEE currently have a piece of work which is working towards this, and we've asked to be part of their steering group, where they hope to come up with an outcome within 12 to 18 months. More locally, we're going to be discussing how we can look to provide some intermediary input as part of this. We want to, as part of that anti-racism strategy, we want to allow people to understand and be aware of their own privilege, and also how to spot and microaggressions. We want to obviously establish our RaceG and AHG networks in collaboration with common areas of interest. And we want to showcase role models from the Black and minoritized ethnic communities through invitation to speak up with all students at LSBU. Finally, here is some of the links that we've been looking at and attribute some of our work to. And we want to keep talking and learning and developing as we move forwards. And things may change and develop as we progress. I'm very pleased to answer any questions about this when we move through to our question and answer session. I'm now going to stop sharing this presentation and move on to looking at our ambitions for the future as part of practice learning in diagnostic radiography. I believe Harry is first up.
Hello again. So thank you so much, Tom. This section on our ambitions is going to be led by myself, Yvonne and Tom. I'm going to do my best Chris Whitty impression and say next slide, as I don't have control on this one. But I hope as well in our Q&A we can have a good discussion about what we can do essentially in the future. So first of all, it's already been mentioned, we really need to be looking at the diversifying our placement opportunities. At the moment, simulation is very much a part of our theoretical component, and it really allows the students to engage with the material they've learned. and then take that forward into placement. And we're really looking at how that can be mixed so it's a more of an even keel. So there's already been some discussion about what kind of sim we do, and we'll be discussing that later on in the Q&A. As Yvonne and Tom both said, research and leadership are huge parts. We are really trying to develop the future leaders of the NHS here at LSBU. So our students understanding research and leadership, not just in specialist placements, which are fantastic opportunities which we're going to be taking forward, but also in the day-to-day is really important to us. The next is looking at more niche providers. So as Yvonne's already mentioned, we already do have interactions with specialist sites such as NHNN, Atkinson Morley at St George's, and cardiac specialists and neuro specialists at King's College and guys in St Thomas's. But we're really looking at expanding our portfolio of those niche providers. And again, like we said, talking more and more with private providers. When I first qualified, the idea of going into private as a newly qualified was completely unheard of. It wasn't even a thing. But we know now that we're getting more and more of our students from the day of qualification working with private providers such as Alliance in Health, for example. And really, we need to be looking at our primary care. Radiographers don't just work in hospitals anymore. We work in polyclinics. We work in these satellite sites. As Violetta said, ultrasound opportunities, and where ultrasound is leading into the primary care setting. So we really want to get our students more and more into those primary cares, more and more to the satellite centres, really to see the diverse opportunities that can be accounted for there. Next slide, please. Thank you. So one of the big things we want to introduce going forward, we currently use a paper format portfolio. As we've done for a long time. We appreciate that our competitors and other HEIs have moved towards the electronic portfolio system, and that's very much what we want to do at LSBU. Especially with the pandemic, we can understand the importance of that. There is obviously questions about authenticity of signatures and authenticity with electronic portfolios, but we believe we're going to take a more pragmatic approach to this and really explore what we can do. Why we want to do it in the future is obviously we can watch live action as students obtain their competencies. We can see the competencies ping up on the screen, which obviously allows us to do more virtual interaction with our students and really monitor how our students are progressing. And really, technology is an embedded part of radiography. So why shouldn't their competencies be part of that? And we really want to embed that kind of technology going all the way through the student's experience. Thank you.
This is my slide, isn't it? So as I said previously, we're really keen to start getting more feedback from our students, and something that's come up across our various AHP forums, including Diagnostic Radiography, is how we use that feedback to make material changes going forwards. So we're going to ensure that we have a succinct feedback approach across all of our AHP programs so that our feedback is consistent and that we can begin to make material changes to our practice learning. We would also like to support our practice educators and acknowledge excellence. So one of our AHP programs at LSBU currently has some AHP Practice Educator Awards, and we would like to expand that across our other programs so that we are so that our students can nominate practice educators for their excellent experience that we have, and we begin to acknowledge that excellence. We also want our students to have some awards for their practice learning experience so that we can nominate students, and students can also nominate themselves, each other. And finally, as I said, we want to ensure that we incorporate anti-racism and allyship training into our practice educator days with HE and the other HEIs. This is something I'm really keen to start doing more of. So this is an example of an evaluation of a practice learning model that we're currently working on with the Royal National Orthopaedic Hospital within physiotherapy. So once, as Yvonne has mentioned, we're exploring leadership practice learning opportunities with the Society and College of Radiography. We hope to begin to evaluate those opportunities in a collaborative approach so that we can begin to publicise and share our work more widely.
Okay, thank you, Tom. So this is me as DR lead for apprenticeship. We're really excited at LSBU because we're now looking at the opportunity to develop apprenticeships. So the reason we're doing this, as you're well aware, there's a workforce need. The radiographers remain on the government's list of national shortage in occupation, and there's a shortage of radiographers nationally. There's also there's a expansion in demand for imaging. So whereas people didn't have MRI and CT, we have a massive expansion in cross-sectional radiography and radiography in general. So anyway, this demand, we've looked at apprenticeships. So there's a national apprenticeship standard that's been developed, and I'm currently looking at how to map this against the current BSc radiography degree program. So the standard, the radiography degree, the BSc apprenticeship will be a 36-month degree, so 3 years. The students will be trained in-house, and it's an opportunity for staff, in-house staff, to develop, progress, and apply for the apprenticeship. 80% the staff work, they will be employed by the trust, and 80% of the work will be in the department. This process, it's quite a long process to develop this apprenticeship standard for BSc radiography here at LSBU, and I'm actually currently mapping this against the BSc radiography program. So by mapping this means I have to look at the apprenticeship standard, I look at the KSBs, that's the knowledge, skills, behaviours and duties, and then I have to go through each module individually and work out whether it's taught, developed or assessed in years 1, 2 and 3. So it's quite 1, 2 and 3, so it's quite a long process. So this will take till the end of the year. I'm actually planning, we're hoping to start recruitment in January 2022 with the prospect of the degree apprenticeship starting in September 2022. So we are actually planning a apprenticeship stakeholder meeting to discuss this with you all, and we're going to help to, where we will discuss our vision for the future, explain what we are hoping to achieve, the concept of apprenticeship, and what this will look like for LSBU. So we're planning that in May or June of this year. So I look forward to sending out invitations very soon. Thank you.
Thanks, everyone. So those are our presentations for today, and we look forward to having a bit of a question and answer session with you now. So I'll hand over to Neil.
Hi there. So there are no questions in the inbox so far. So if you do have any questions for our panel, please do pop them in there. We'll start off with a general question until those get started, and I'll pop it to all of my colleagues on screen. What are the biggest challenges and lessons that have come out of kind of like working through the pandemic for the students and for the future of the profession? So we'll get that to get us started. And Thomas, I'll come to you first.
Oh, don't come to me with that question. I'm going to redirect that question to Harry and our student Violetta. So it'd be good to hear from Harry about how our students have done, and it'd be good to hear from Violetta about her experience during the pandemic.
Okay, and thank you. So first of all, I want to say that I think the students have done an amazing job working through the pandemic. I think that the NHS and the country, we know that without them, the workforce would have crumbled, really. So I think really, they've done a huge job to really bolster what we're able to achieve. I think one of the biggest challenges, obviously, for us as a university and in communication, is often, obviously, we at LSBU work according to government guidance. We know that from our own on-campus allocation. So we know LSBU's got one of the best, it's best for it's one of the lowest rates of COVID cases, because we take the information and the guidance given by the government very seriously. So often one of our big challenges was that the fact that sometimes this guidance would change on a weekly basis, sometimes even daily basis. And we did our best to obviously communicate any of these changes and make sure that everyone's safe. We want to make sure the students are safe, the staff are safe, patients are safe. That's our top priority at LSBU.
Thank you. And Violetta, we spoke a little bit about your experience yesterday. Would you like to share a little bit more with us?
Yes, no, I have to say that big thank you to all the teaching team, because I know it's been a really challenging year. And I have to say, I was really, not just me, obviously, the rest of the students as well, we were updated on a weekly basis, because as Harry said, there were changes all the time. So it was nice that we were informed about any changes, if there were obviously changes. And I have to say, although we were with all the teaching, so face-to-face teaching was unfortunately cancelled, that did not affect the quality of teaching. And I think I have to make that point because it's important. Although we moved on to online learning and remote lectures, I think the lectures were really delivered really well. And the quality was still there. And being a student in pandemic is difficult, really challenging, especially at the beginning, because we really didn't know what's going to happen, what to expect. But very quickly, students were recognized as key workers. And like Harry said, we really are part of the team, and we are really there to help, to give that, to be that extra pair of hands. And so it's been a challenging year, but really I learned a lot this year, I have to say. Yeah.
Thank you. Would any of our other panelists like to come in?
I would just like to say that the pandemic's silver lining with respect to practice learning is we've really seen how different AHPs have been able to complete these opportunities in such a diverse range of settings, and it's opened a lot of people's eyes to these diverse opportunities. We are still continuing for diagnostic radiography. We have increased our the course by 10 students, so we are looking for 10 more sort of diagnostic radiography practice learning places. And if you're interested, I think Harry put his email in the chat, so please do email him, so we can begin to explore these opportunities. And it'd be good for us to continue to explore the other pillars of practice as part of those student selected placements. That's all I wanted to say on that.
Thank you. Anyone else? If not, we'll move on. No, okay. There was a couple of questions that came through in the Q&A box, and I know that Claire kind of answered those, but just in case our audience did miss them, we'll just go to those. So we're talking about the simulation. So MedSpace XR. We've got do you do any pediatric simulation, and could MedSpace be incorporated into a split placement model in order to increase placement capacity? Claire, are you able to elaborate on those a little bit?
Yeah, as I sort of said in my responses, in terms of the VR, at the moment it only offers an adult sort of avatar, but we're in very close contact with the people that created the program. We're constantly giving them feedback, so we've found a few things this year using it that would improve its functionality and its teaching capability for us. So things like being able to use trauma positioning within the package. It might be key to mention that it's also got a CT room and a theatre room within the package as well. We're not currently sort of utilising those, but those have also got lots of potential in terms of teaching students. I don't think it can be a replacement or necessarily a split model. I suppose that remains to be seen, really. That's happened for our first year students this year, but we'd have to sort of see how that affects them sort of in the longer term and get feedback from them on that.
Thank you.
Can
Harry?
I just add, so for the paediatric simulation, some might know paediatrics is actually a huge part of my professional role. So I'm actually the secretary to the Association of Paediatric Radiographers, and I work nationally on trying to improve the kind of education of paediatric imaging. And I've already started conversations with Gary Francis, who's our Associate Professor for Skills and Learning in the Institute of Health and Social Care, on how we can start interprofessionally working with other departments such as Advanced Clinical Practice and the Department of Children's Nursing, and more face-to-face simulation, and how we can use the kind of the mannequins and the kind of sim kit that we've already got to try to engage radiographers into that practice, so we get some more sim that way as well. So all I can say, MedSpace VR potentially for the future, we are starting to explore how we can integrate some physical skills workshops. And in terms of MedSpace, that split placement, obviously, like we said, at the moment, we work to the standards of proficiency and our validation with the HCPC, and which very much identifies simulation as its own kind of bubble. We have theory, we have simulation, and we have placement. And obviously, as things are progressing, the HCP standards might change and how we interact with that, but we really are looking at how we can make sim kind of more interspersed between the both components, the academic and the placement, and really kind of tie those in together even more so to kind of utilize that more effectively.
Thanks,
just
Harry.
thinking, sorry, I was just thinking, just from my experience, just to add on to it regarding the simulation software, because I have used it. I think it's a great tool, additional tool. I don't think it's a replacement for actual clinical placement. So I think it's important that students still do go into placement and gain that real life experience. But I think it was a great tool that was just there, especially when my placement was cancelled, that I could just use and go back and sort of review my radiographic technique skills. So it's a great additional tool, but I don't think it's good to just replace the clinical placement. Yeah.
Thanks, Violetta. That's all the questions we have. Thomas, I'll hand back over to you to close.
Thanks, Neil. Thank you, everyone, for attending this diagnostic radiography event. If you would like to talk with us further about expanding your diagnostic radiography practice learning placements, please do get in touch with us. We are keen to explore that further. And we're also keen to explore our elective placements through leadership and research, which is something that Yvonne has mentioned. So we'll finish it there, and thank you very much for attending.